and Mr. Emmett Patterson, who is the Global Health Projects Manager at GRINDR for Equity. Mr. Patterson?
I appreciate your being flexible, and again, thank you so much for having me and for your time. I'd like to go along with my two other co-presenters and just walk you through some of the work our team has done at GRINDR, which is the largest social network app for gay, bi, and trans people around the world, specifically our work as it relates to STIs and sexual wellness globally. So who is GRINDR for Equality? GRINDR, the app itself, was founded about 10 years ago, and GRINDR for Equality, or G4E as I might call it for shorthand, was started about 6 years ago. And so our team focuses on the safety, health, and human rights of LGBTQ people around the world. And I'll explain more in just a little bit about the functionality of what that charge means to us as a team. But when GRINDR for Equality's director and current vice president of social impact, Jack Harrison-Quintana, came on to head our team, it was the first time that someone had been given a dating app and said, hey, can you use this for social justice? Jack actually remembers some of his initial conversations with the founder of GRINDR, who was very concerned about what was happening for queer Syrians fleeing Syria during the rise of ISIS in the mid-2010s. And in this conversation, the founder said, I see that queer Syrians are suffering, but there's obviously nothing we can do about it. And Jack turned to him in response and said, well, I don't think it's nothing. So that was the beginning of GRINDR for Equality. We reached out to our activist network that we had built in our private and other professional lives as activists in the Middle East, North Africa, and Europe to find out where to send queer Syrian GRINDR users for things like legal services, health services, and even transition-related care for trans folks who are arriving in new countries. And so since then, GRINDR has deepened our activist networks through our own activism work throughout Latin America, Eastern Europe, South Asia, and the Middle East, North Africa. But more specifically, as the Global Health Project Manager of GRINDR for Equality, ensuring that queer people, both who use GRINDR and who don't, are able to take control of their health and well-being is central to my daily work. And it's the essential way that social justice shows up in my life, ensuring that queer people have basic information and control of our bodies and our health. Next slide, please. So why does social justice matter for people who use a social network? Well, I know that we all may have our assumptions about who may or may not be using GRINDR, but when we think about who uses the app, we have to remember that they come to the app for many different reasons, among them sex and dating, love, friendship, and even community connection, knowing that there's just another queer person out there. But our users are up against a lot in their day-to-day lives. I know if I look at the image that you have in front of you, I can put myself in the center of this map and see the experiences that have surrounded me that construct the ways that I lived not only when I started using GRINDR as a queer, white, trans man coming from Appalachia and now living in the U.S. major coastal cities. I'm sure you all can find parts of yourself on this map too. But I do just want to talk a bit about what our users are up against structurally. So our team works where app users live, which is in every single country in the world. And people come to GRINDR for very different reasons and also come from very different backgrounds of oppression. And so some of our users face queer specific stigma from the cultural norms that are surrounding them and even criminalization based on sodomy laws. And other times, app users are facing homo, bi, and transphobia within a bigger context of what their community members at large are facing. For example, genocide and war, forced migration from violence and now changing climate, as well as government monitoring. So when we move closer to the center of where we are, when we look at the interpersonal, we see that the structural oppression that we face often informs the interpersonal things that may come up both on and off the app. So both in the real world and at times on dating apps and social networks, things like HIV stigma, racism, classism, and ableism, as well as shaming, and the sort of identity theft rears their ugly heads. And I think the reason that I really want to talk about these big pieces around us is because when it comes down to the interpersonal, we're not just a person using an app for an individual reason. We come to this because we're informed to do it by our experiences. So as queer people, we face a lot of internalized stigma and shame around our identities, and especially our sex lives. which isn't surprising taking into account some of those structures and relationships and experience that surround us. And at that interpersonal level, this leads to, it impacts our mental health and well-being as we try to find our way in a world seeking to remove us from it. Next slide, please. So with 4.5 million daily active users, and we have GRINDR users coming, from every part of the world, our team is tasked to protect safety, health, and human rights, and we are tasked with a lot. Each user is coming to the app with their specific needs and ways that they want support, especially support around their sexual health based on their context. And while all queer people are governed by expression at any or all of these levels, where we live, what we sound like, what we look like, and who we're surrounded by determines which of these factors impact us every day. Next slide. So I know I'm here today to talk specifically about sexual health and more specifically about combating STI epidemics, but I did want to take a chance to talk about how GRINDR more operates broadly while giving you specific STI examples. So everything that I'm saying is really core to our work, as you'll see on the screen. And I'm only going to give you the STI examples, but there are quite a few other pieces that go into each of these components that I won't mention today. So as I said, we have 4 main components to our work, and I'm going to start at the bottom in the gray. So funding. Since its start, GRINDR for Equality has provided funding to underfunded or unsupported queer organizations around the world. And our funding has been responsive to emerging issues, including public health emergencies and safety needs for queer people in vulnerable communities. So, for example, this November, GRINDR for Equality granted a total of $100,000 to organizations in the Middle East and North Africa to promote LGBTQ health and safety. And among those projects are direct services for people living with HIV, training and digital security for LGBTQ people, which we know is part of sexual violence prevention, as well as we're planning to do a health needs assessment with lesbian, bi, and queer women, many of whom are on the app in the Middle East and North Africa. And so overall, we have also focused on experimental public health strategies created by local communities that don't typically receive traditional funding. I've been loving hearing so many people endorsing home test kits, and I was proud in 2018 that we partnered with Single Step Foundation, a national Bulgarian LGBTQ support network, to create the country's first ever HIV home test pilot using social media platforms like Facebook, Instagram, and of course, GRINDR. Through GRINDR, we delivered over 1,000 home test kits in over 150 Bulgarian cities, and that was just in 3 weeks. And so while it's not exhausting, our funding, as well as our collaboration on new projects, has seen major response in vulnerable communities and has had a major impact on community sexual well-being. So the next component that I'm going to be focusing on are the features of the app. So you heard from Dan earlier, working in partnership with Building Healthy Online Communities has been completely instrumental in developing the majority of our sexual health features and vetting our emerging scientific information related to STIs. And so what we've been doing with GRINDR for Equality is that we've been looking for ways to infuse social justice within the app infrastructure itself. And we've done that in really 2 principal ways. So the first is that we've developed new profile fields that, 1, give users the option of posting their HIV status, and 2, give users the option to indicate the last time they were tested for HIV and or STIs. The second way that we've changed the app infrastructure, specifically it's to account for sexual health, has been that we worked with Building Healthy Online Communities to create testing reminder functions so that users could set a regular reminder for either 3 or 6 months that it's time for their next HIV and or STI test. So these specific profile fields really are about creating easy, low-anxiety ways for users to communicate about their sexual health. We also have 3 specific resources that include STIs as part of a holistic way to take control of our health. Our Holistic Security Guide and Resource Center just launched last week, and it brings together caring for one's sexual health with best practices for digital safety and personal safety, especially when dating, hooking up, or connecting with queer people in dangerous areas. Our Gender Identity Resource Center features information geared for cisgender users on the app on how to respect trans and non-binary users. It's a growing resource that includes information for trans and non-binary people on how to prevent pregnancy, how to prevent and get treated for STIs. And this is especially important to us because public health information continues to speak in what I would consider unnecessarily gender-based language, like, quote, testing for men and women, rather than focusing on body parts that need to be tested, which often alienates trans and non-binary users from their actual risk for STIs. That's a critical function of our team at GRINDR, to make sure that trans folks are not being left behind when it comes to taking control of our sexual health. And our final resource that we have is our Sexual Health Resource Center, which, as Dan mentioned earlier, has been read over 16.1 million times in the last 3 years, and it includes critical information for queer folks when it comes to STIs. We really created this resource because GRINDR users told us they wanted more information about their sexual health. They wanted to know about PrEP. They wanted to know what it meant to be undetectable, and they also wanted to know what to ask for from a provider when they were going to get an STI checkup to make sure that it was complete as possible. Right now, the Sexual Health Resource Center is available in 70 written languages. It is just now being launched in spoken Indigenous and global sign languages, and we've expanded to include a wide range of topics around consent, home testing, and how to tell a partner about a positive STI test result, specifically focusing for people who experience the threat of intimate partner violence if disclosing a positive test result face-to-face. Our users are often living in areas where accurate and affirming information about queer people and our sexual health may not be available or even accessible in a language that we can read. And so using the app's global reach, we frequently send the different language versions of the sexual health resource directly to queer people where they're using the app. I'm going to jump up to research and be very brief here. There are really two ways that we incorporate research into our work. The most central way is that we partner with trusted community-led researchers and university teams to promote their surveys and focus groups on the app through our messaging platform. So using GRINDR really as a recruitment tool. And the second is we sometimes do GRINDR for Equality initiated surveys. We really want to better understand in real time what our users are facing when it comes to sexual health, what features they might need in the app, and what content we can be adding to things like the Sexual Health Resource Center. And I think I'll end with messaging, because this is perhaps the biggest way that GRINDR for Equality supports community organizations and queer people is through our broadcast partnership program. So we work with local LGBT advocacy groups, sexual health organizations, feminist organizations to use the app's global reach to relay health and safety information. From HIV and STI testing locators in the Middle East to supporting a UK campaign about syphilis that I believe Dr. Perk mentioned earlier. We connect users to community organizations for localized STI prevention services and support. And we really think that we have a unique opportunity and a role to play because not all LGBTQ people are connected to supportive health services or even LGBTQ community centers. So using GRINDR allows us to bring that information to them without the need for them to download a specific app for sexual health or visit a brick-and-mortar center. It helps us reach folks who also don't identify as LGBTQ, but still may be vulnerable to STIs, among other health concerns. And finally, I believe it helps us reach people in rural communities, in violent contexts, and people in truly mobile contexts for those who may be fleeing persecution or danger or as migrants and asylum seekers. And so using our geolocation functionality, we've also worked with public health officials to respond quickly and specifically to threats to our health and safety when and where they occur. Over the last year, I've been proud to scale up our outbreak advisory program, and we've partnered with more than 20 U.S. Departments of Health, the Centers for Disease Control and Prevention, as well as international ministries of health to respond to emerging outbreaks. More specifically, hepatitis A, meningitis, syphilis, and STIs overall. And in 2019 alone, we've connected over 4.2 million people to public health-related information about outbreaks in their communities. In Morgantown, West Virginia, like I said, I'm from Appalachia, just 30 minutes away from where I grew up, we reached almost 70,000 people in 6 months with syphilis outbreak advisory in what I would consider an STI treatment and testing desert because I've experienced it as a queer and trans person. So in Morgantown, local STI clinicians and nurses have reported that an increased number of patients showed up at testing clinics asking for syphilis testing, specifically citing the advisory alerts that they had seen on GRINDR. as a reason for seeking testing or care. So we've worked with health departments on these outbreak advisories, but we've also know that there are really big differences when we've worked with LGBTQ community centers that do their own public health emergency response. We worked with Bradbury Sullivan Community Center in Allentown, Pennsylvania. We promoted a campaign called If You Like the Taste of Peaches, a very sex-positive campaign about oral transmission of hepatitis A. So users on GRINDR were sent a message, and it said, hey, Bradbury Sullivan wants to give you a Hep A vaccine for free. The community center worked with their health department to set up daily vaccine clinics. And what we found is that folks were really excited to go to the community center much more than they were excited to go to a lot of our health department partners because of the medical distrust and the discrimination and violence that's so endemic in queer communities. Partnering with LGBT centers is definitely a way that we've been able to keep folks engaged in testing and treatment. And so just kind of to close out that section, we can respond quickly and urgently to public health concerns. We can connect queer people to care for testing for STIs, which also allows them to get testing, treatment, and other types of medical support for other co-occurring health issues. Next slide, please. So in closing, I, like many speakers, have considered some of the opportunities that we all in this room and on the phone can collaborate on when addressing STI outbreaks when and where they occur. At GRINDR for Equality, we will continue to work in partnership with public health experts, especially building healthy online communities, local community leaders, and app users to develop features and information that reflect local needs. We also see opportunities to increase access to critical STI treatments, home test kits, and safer sex materials, especially for GRINDR users in rural or isolated areas where these items may not be either geographically or financially accessible. For queer people, sex-positive affirming campaigns are a godsend. Our bodies are often described by health officials in ways that reflect HIV and STI stigma that's garnered attention for decades. Our sex lives are described as risky, and we're infecting those around us. Language matters, and the need for sex-positive affirming campaigns directed by queer people for queer people is essential to curtailing STI outbreaks. Addressing HIV and STI stigma is a huge part of this. Last year, GRINDR launched KINDR, which is a campaign to promote kindness among GRINDR users. We also updated our community guidelines to better reflect this. So anyone who is discriminating against folks living with HIV, who's harassing folks for a publicly listed HIV status or anything listed in their profile can have their profile banned. And like Dan said earlier, we're happily supporting building healthy online communities, Nice AF. I'd be really careful about saying those letters instead of what they mean. But we're happy to support that campaign as it rolls out of its pilot phase. And then from our outbreak advisory program, we've seen time and time again that we can be responsive to emerging sexual health concerns in collaboration with health departments and LGBTQI community centers, which respectively, we provide the platform, health departments provide the medical knowledge, and the community centers provide the trust needed to end these epidemics. And finally, as always, we need holistic, centralized, and localized health education resources that are engaging and useful for queer people who deserve good information about our health and well-being. The lights just went off from the motion sensor, so I think that's my time. Thank you all so much.
Thank you.